our neighbors, our friends, our colleagues. Across the nation, a silent healthcare crisis is very likely affecting people you know. Until recently, this crisis received little attention, and yet it threatens both our health and our economy. It's called chronic disease, and by some estimates, chronic diseases affect nearly half of all Americans. Chronic diseases are conditions that cannot be cured, but they can be managed. They include diabetes, high blood pressure, heart disease, and many others. Why the rise in chronic illnesses? Age and lifestyle choices are important factors. We are getting older as a nation, and fast foods, smoking, and a lack of exercise are taking their toll.
So there's this wave of lifestyle-driven chronic disease that is really showing itself mostly in diabetes. And if you look ahead, people talk about the diabetes bomb. And the combination of the age wave and the growing prevalence of diabetes is what's really scary about the future of American healthcare, because these are very costly diseases to treat.
Okay, I'd like to go ahead and take your blood pressure. It's been fine, but you know how concerned I am about maintaining the right pressure with your diabetes and your coronary disease. Okay.
And at the same time, the rising cost of healthcare, coupled with a poor economy, means more people are finding themselves without insurance or access to healthcare.
The patients that come here are just like us on a bad day. They've had some circumstances, they've got laid off. A lot of them have exhausted all their resources before they come to us. So we see people that are awaiting disability, we see people that have laid off, we see people that are working but can't afford to pay for a premium. So these are people just like us. Their circumstances are slightly different.
It's just the right thing to do to show compassion, restore dignity, make people feel good about themselves for a sect of our community, which is often kind of forgotten about or downtrodden.
A rising tide of illness, increasing costs, fewer insured people, and dwindling resources mean one thing. Many communities around the country are struggling to cope.
The reason we want the whole grains is because when you eat these, they last so much longer.
One community, however, is finding solutions. In the Williamsburg, Virginia area, an innovative approach to treating chronic disease is producing remarkable results. It's called the Chronic Care Collaborative. Funded by the Williamsburg Community Health Foundation, the collaborative brings together nonprofit healthcare organizations to address the surge of chronic disease. This year, the collaborative will treat more than 5,000 uninsured and underinsured patients. One partner in the collaborative, Rx Partnership, makes sure patients get the prescription medicines they need to control their conditions.
Rx Partnership started in 2003 in order to really address the needs of the population who are seeing doctors at free clinics or community health centers and need to be able to have the medication to treat their chronic conditions like diabetes, hypertension, asthma, COPD. These are the kinds of things that without the medication, it really undermines the work of those doctors who are volunteering their time. So we ensure that the shelves are stocked at these free clinic pharmacies and patients can more easily and quickly get what they need in order to manage their conditions effectively.
Chris Dyke came to the Gloucester Matthews Free Clinic facing serious issues. He lost his business to the recession. He lost a daughter to lung disease. And then he lost his health to diabetes. At age 40, his diabetes triggered a heart attack. The clinic staff taught Chris to manage his illness through diet, exercise, and medication. But with no health insurance, medications were far out of his reach.
My prescriptions run about $2,700 a month, which comes out to about what I make a month. If it weren't for that, without them, there's no way I could afford them. And it's the partnership between the clinic and the drug medication companies have been really good to me, because there's no way I wouldn't be here right now if it weren't for that.
At the Lackey Clinic, a volunteer pharmacist carefully prepares prescriptions for patients in the clinic and ensures the shelves are stocked and well organized. Eric and Sherry Colbert each have chronic illness, and as a couple, they've been in financial distress. Through the work of the collaborative, however, they're able to keep afloat.
I'm on high blood pressure medicine, cholesterol, Wellbutrin, which is an antidepressant, and I suffered from anxiety too, so and also pain. So they've given me tremendous help with the prescriptions. I mean, there's no way we could even afford it if it wasn't for Lackey Clinic, because I think they add up to around the $2,000 mark a month. So it would be impossible. And this was just a God-sent blessing, this clinic, because there's no way in the world I could afford that.
Clinics are the ones who see the patients. They have that direct patient care. So our role is to be able to stay as connected to them and understand the needs of the clinics as clearly as possible to do what our organization does well, which is some of those high-level partnerships that make the pipeline possible for the medications.
Every provider is going to be forced to find the most innovative and efficient ways of dealing with chronic illness. They're going to need to learn from each other, because so many aspects of this care model are small things that if you do them once, you may save $1 or a minute of time. But if you do them 1,000 times or 10,000 times or 100,000 times, you're talking about serious savings.
Here's an amazing statistic. One clinic tracked emergency room visits by their patients and found fewer than 1% visited emergency rooms in the past year. That's due in large part to the attention and quality care they receive from healthcare professionals who are dedicated to their communities.
Underneath that visible level of leadership, you see volunteers and paid staff in these clinics who are doing heroic things every day. The commitment and the passion there are incredible. Honestly, it makes me feel like I'm in the presence of very heroic people.